Today we will study about the bones of general anatomy. The bones part of the general anatomy is the topic of today's discussion. Now, this bones or skeleton is of the body is composed of bones, cartilages. Both bones and cartilages are made up of the specialized connective tissue that is called the sclerous tissue, which can bear the weight without bending or has considerable tensile strength. The skeletal tissue consists of same component is called as the matrix as that of general connective tissue. Now, the function of the skeletal system is as follows. The functions are the forms a rigid framework of the body, provides protection to the viscera, such just like the brain, heart, lungs, etc. of the body from the external injury, and provides leverage of the body movements. Now, what are the types of skeleton are there in the human body? The skeleton is divided into the two types. Okay, the skeleton is divided into two types. One is axial skeleton, one is appendicular skeleton. Okay, the axial and appendicular skeleton. Now, the axial skeleton consists of bones and cartilages that lie close to the central axis of the body. Central axis of the body means, suppose this is the central axis of the body. This is the central. The axial skeleton, which lies close to the central axis of the body, is known as the axial skeleton. The central in between the central axis of the body, such as you can see the skull bone, the auditory ossicles means auditory bones, ear bones, the hyoid bones, the vertebral column, and the rib cage, which lies in the central axis of the body, means here, central axis of the body. Okay, close to this, from here to here. This skull bone, auditory bones, hyoid bones lies here, the rib cage lies here, and the vertebral column. Okay, now another is the appendicular skeleton. Appendicular skeleton is the bilateral symmetrical comprises of bones of the upper and lower extremity. Mainly upper extremity and lower extremities are called as the appendicular bones. Thus, it includes the bones of the pectoral girdle, upper limb, pelvic girdle, and lower limb. Okay, that these are the appendicular bones. Here, these are the appendicular bones, the pelvic girdle, okay, and the pectoral girdle. Here, this is the pectoral girdle. Okay, now we'll know about how many bones are there, total number of bones. Total number of bones are there. Number of bones present in the axial and appendicular skeleton. Number of bones present. Okay, the skull bones. First is the skull bones. Under skull bones there are cranial bones. Total number of 8 cranial bones are there. Total number of 8 cranial. In the 8 cranial bones there are also division. We'll read it later. And next one is the facial bones, which is 14 in number. Higher bones 1 in number. Ear bones 6 in number, both ear, 3 in each ear. Okay, the vertebral bones is 26 in number. And next one is the rib cage. Rib cage is one sternum, 24 ribs bilaterally. Total number, the axial skeleton consists of total number of 80 axial skeleton. Okay, the axial skeleton consists total number 80. And next one is the appendicular skeleton. Under appendicular skeleton, one division is the pectoral or shoulder division. In the pectoral division, clavicle is there, 2 clavicle on each side. And next one is the upper limb. Upper limb humerus 2 number, ulna 2, radius 2, carpal bones 8 and 8, metacarpal 5 plus 5, and phalanges 14 plus 14 in the both region. And next one is the pelvic curtain region. Pelvic curtain region, there are 2 hip bones on both sides, and lower limb consists of 2 femur, 2 fibula, 2 tibia, 2 patella, 7 plus 7 tarsals on the both sides, total 14 metatarsal phalanges. Total number of 126 bones in the appendicular skeleton. Total is axial skeleton consists of 80, axial skeletal consists of 80, and appendicular skeleton consists of 126. Total number of bones of the body is 206. Now we'll study the next portion is the bone portion, which is our main topic today. The bones are the hard structure which forms the rigid framework of the body. Structurally, bone is a highly vascular mineralized connective tissue consisting of cell and dense intercellular matrix. The organic material mainly consists of the collagen fiber, and it forms 1/3 of the bone. The collagen fiber consists of the 1/3 of the bone. Okay, and it provides resilience to the bone. The collagen fibers provides resilience to the bone. The 2 parts are the organic part. These are the organic part is the collagen fiber, and inorganic material mainly consists of the calcium phosphate and other trace of other salts. So one portion is organic, another portion is inorganic, and organic portion consists of the collagen fibers. The inorganic consists of the mainly calcium phosphate and traces of the other salts. Okay, now the bone is not an inert material as often though by the student. It is the living structure. It is supplied by the blood vessels and nerves, and also the lymphatic vessels. It has the power of regeneration automatically. That's why the bone, if the bone is break or fracture happen, it also repairs. So it is not an inert material. That's why it has got the blood vessels, lymph vessels, and nerves. So by consisting these blood vessels, lymph vessels, it has got the power of regeneration. Okay, now next portion is the function, the most important portion, the function of the bones. Functions are mainly the form rigid framework of the body to keep it shape and support. And next one is the provide surface for attachment of muscle, tendon, and ligament. It provides surface where the muscles, tendon, and ligament attached. Okay, next is to serve as the lever for the muscles to bring about a movement. It acts as a lever for the muscles. It acts as a lever for the muscles to bring out any particular movement of the body. Okay. Next one, the protect the certain viscera, just like brain. The brain covers with the cranial bones. The spinal cord covers with the vertebral. The heart is covered by the ribs. The lungs is covered by also the ribs. Liver is covered by ribs, and urinary bladder, etc., is covered by the pelvic bones. Next portion, it contains marrow, which is the factory of blood cells. The bones contains the marrow, which is factory of the blood cell, have white blood cells and red blood cell and platelet, from where it produce. Next, it is storehouse of calcium. It is inorganic part. Calcium and phosphorus. About 95% of the phosphorus within the body is deposited in the bones and teeth. 95% of the phosphorus within the body is deposited in the bones and the teeth. Last one is the bones around the nose, which contains large cavities filled with the ear, which is the facial bones mainly, and it is filled with the cavity which contains the ear. Okay, so these are the functions of the bones. Next, we'll go to the microscopic structures of the bones. The bone is specialized connective tissue and consists of the following three components. Mainly, the three components are the cells, ground substance, and the fibers. Okay. 1 minute. The ground substance and fibers together form the intercellular substance, or it is also known as the matrix of the bone. This portion, the ground substance. 1 minute. The ground substance and fiber together form the intercellular substance or matrix. The ground substance and the fibers together form the matrix, or it is also known as the intercellular substance. The bone cells are of three types. So, microscopical structure of the bones mainly contains of three. One is the cell or bone cell, number two is the ground substance, number three is the fiber. Here, the ground substance and fiber together forms the matrix, and the bones cells are of the three types. One is osteoblast, second one is osteocytes, and third one is osteoclast. Now we'll go to these topics of osteoblast, osteocytes, and osteoclasts. What are these? Osteoblasts. The osteoblasts are derived from the pluripotent of the osteoporonics progenitor cells located in the mesenchyme, periosteum, and endosteum. They secrete the osteoid, which is unmineralized matrix containing proteoglycans, glycoproteins, and type 1 collagen fibers. And next one is the for mineralization to occur, the osteoblasts secrete osteocalcin and alkaline phosphatase, which release calcium and phosphatase radical from the substance containing with them. The next, in addition, osteoblasts release the matrix vesicle, which concentrate calcium and phosphate, and are most important factors necessary for mineralization of the bone to occur. The osteoblast bones also undergoes the mitosis formation. Okay, and they are the precursor cell of the osteocytes, the mitosis formation. Okay, the next portion is the osteocytes. Osteocytes are derived from the osteoblast. The osteocytes derived from the osteoblast. Once an osteoblast becomes surrounded by matrix, it becomes a osteocyte. What is matrix? The ground substance and the fibers together form the matrix. When the osteocytes, osteoblast becomes surrounded by the matrix, osteoblast becomes surrounded by the matrix, it becomes an osteocyte. Okay, osteocytes are flattened cells and numerous cytoplasmic processes. They are located in spaces within the matrix called lacuna and canaliculi. This is the important. They are located in the spaces within the matrix called a lacuna and canaliculi respectively. The cytoplasmic process of the neighboring cell communicate by the gap junctions. Okay. The osteocytes, unlike osteoblasts, do not undergo mitosis process. The canaliculi radiate from each lacuna and permit diffusion of the nutritive material. Thus, the cell remains alive in the calcified matrix and maintain the bone by their balanced osteogenic and osteoclastic activity. They secrete alkaline phosphatase to maintain the calcification. When bone cells die, the matrix is decalcified. Okay, now we are trying to understand the osteocytes. So these are the osteocytes. These are the osteocytes. Okay, here it is as the canaliculi, and the between these there is the lacuna. Okay. Next is the osteoclast. The osteoclasts are derived from the fusion of the uncommitted cells of the red bone marrow that are related to a type of white blood cell called the monocytes. Okay, they are large in number with multiple nuclei. They help in resorption of the bone and play important role in the bone remodeling. They reside in the shallow depression of the bone called as the Hausipps lacunae. It is important, Hausipps lacunae. Next one is the ground substance. It contains following component. The ground substance. Another number one was the cells. Three types of cells: osteoblast, osteoclast, and osteocytes. And next one is the ground substance. It consists of the following component. One is proteoglycans, some containing the side chain of the glycoaminoglycans or GAGs, especially chondroitin sulfate and keratin sulfate. Next one is the glycoprotein. One is proteoglycan. Next one is glycoprotein such as osteonectin and osteocalcin. And third one is the mineral component that includes the calcium phosphate crystals and citrate ion and bicarbonate ion. Okay. Next one is the water particle or tissue fluid contributes to a low degree of bone hydration, only 7%. And last but not is the fibers. The fibers are the type 1 collagen fibers. Always remember, type 1 collagen fibers, which provides the tensile strength to the bone. The type 1 collagen fibers. Okay. Next is the classification of the bones. In classification of the bones are usually classified in the three ways: according to the shape of the bones, according to the structure or structural classification of the bone, and according to the development or developmental classification. Okay. In classification according to the shape, it depending upon the size, shape, etc. The bones are classified into the following types. First one is the long bones. Long bones, short bones, flat bones, irregular bone, pneumatic bone, sesamoid bone, and accessory bones. Okay. The number one is the long bone. We'll go to the long bone portion. Long bones are those which in length exceed the breadth and thickness. Its length is greater than the breadth and thickness. The long bones are of mainly two types: typical and miniature or short. Okay, long bones are of the two type. The number one is typical long bones. The typical long bones, they consist of the following features. Number one consists three parts. One, elongated tubular shaft. Three parts. One is the shaft. Two, extended ends, upper end and lower ends. The shaft portion is also known as the, we'll read in the another portion. Shaft portion is also known as the, 1 minute. Shaft portion is also known as the diaphysis, and the extended or expanded ends of the both sides is also known as the epiphysis. Okay. Number two is the content medullary cavity, which filled with bone marrow. Medullary cavity filled with bone marrow, and it ossifies in the cartilage. Okay, the typical long bones, and they are of mainly weight bearing bones, are found in limbs only. Most important, limbs only, and act as the levers for the muscles. The example of typical long bones, try to keep the example. One example of the typical long bones are the humerus, radius, ulna, femur, tibia, and fibula. Okay. Next one is the miniature long bones. Miniature long bones, these are much shorter in length as compared to the typical long bones, with epiphysis present at one end only. Here, the typical long bones, the epiphysis present in the, 1 minute, the epiphysis present both end in the typical long bone, and in miniature or short bones, the epiphysis present at only one end. Okay, this is the difference, man. The example of miniature long bones are the metacarpals, metatarsals, and phalanges. The metacarpal or metatarsal have epiphysis at their distal end only, except for the first metacarpal and first metatarsal, which has epiphysis at the proximal end only. Okay. Now here we have read about the long bones. Long bones were of two types. Number one is typical long bone. Number two is miniature long bones. Next one is the short bones. Yeah, here is the example of the long bone. Okay, and this is the typical long bone, and this is the miniature or short long bones. Example as metatarsal. Okay, now the short bones. Short bones are small in size and usually cuboidal in shape. It is usually cuboidal, spherical, representing the 6 surfaces. These bones are found in the wrist, such as carpal bones, and foot, known as the tarsal bones. Okay, see, this is the tarsal bone example of the short bones. In hand or wrist found the carpal bones. Now the flat bones. Number three, flat bones. Flat bones are flat and shallow plate-like bones. They form boundaries of certain body cavities such as cranium and thoracic cavity. The example of flat bone are bones forming cranial vault or cranium bones. The cranium bones I already called as the frontal, parietal, occipital, temporal, etc. The bones forming the thoracic cage such as scapula, ribs, sternum. These are all under the category of flat bones. All under the category of flat bones. Okay. Number four is the irregular bones. Irregular bone highly irregular in shape such as hip bone. vertebral bone. They are specified, not specified shape. They are not specified shape. Okay, such as hip bone, vertebral bones. They are base of the skull bones. They are not as specified bones. Uh, Number 5 is the pneumatic bones. Why pneumatic? Pneumatic are the variety of irregular bones. It is also one type of irregular bones, but it has special features in it, which contains the fluid, which contains the air. Sorry, which contains the air filled cavity within them. The pneumatic bones. I also such as the nasal cavity, maxilla, frontal, sphenoid, ethmoid. There contains the air-filled cavities within these bones, and these are called the paranasal sinuses. What you read about this? See, in the here, here, one of the function of the bone. The bones around the nose contain large cavities within which contains air, such as the pneumatic bone. Okay. The next one, we'll go to the sesamoid bones. Most importantly, it comes under the short note. It is most important topic. It comes under the short note of 3 marks or 5 marks, whichever is the sesamoid bone. Most importantly, this short note comes in sesamoid bones. Sesamoid bones are seed-like bony nodules which develop in certain muscle tendons where they rub against the convex bony surface during the movement of the joint. Convex bony surface, which when the movement of the joint occurs, the muscle tendon rubs against the convex bony surface, where it is the patella. The rubbing surface of the sesamoid bone is covered within an articular cartilage. Within an articular cartilage. Okay. Thus, main types of sesamoid bones are the sides. Number 1 is the patella in the tendon of the quadriceps femoris in front of the knee joint. Okay, patella is the sesamoid bone where the quadriceps femoris tendon rubs against the patella in front of the knee joint. Number 2 is the fibula, is the lateral head of the gastrocnemius behind the knee joint. Behind the knee joint there is the fibula which rubs in the lateral head of the gastrocnemius. And 2 sesamoid bones below the head of the first metatarsal bone in the tendon of the flexor hallucis brevis. Tendon of the flexor hallucis brevis. One sesamoid bone in the tendon of the peroneus longus where it binds around the cuboid bone. And number 5 is the pisiform in the tendon of the flexor carpi ulnaris. Okay. Number 6 is the one sesamoid bone of the ulnar side of the head of the first metacarpal bone in the tendon of the adductor pollicis. And lastly, sometimes a sesamoid bone is found in the radial side of the head of the first metacarpal in the tendon of the flexor pollicis brevis. Okay. And lastly, the functions of the sesamoid bone. The function acts as a pulley. To act as a pulley for muscle contraction, alter the direction of the pull of the muscle, and minimize the friction of tendon against the bone to prevent its attrition. Now the characteristic of the sesamoid bone developed in the tendons of the muscles. Okay, developed in the tendons of the muscle. Most importantly, number 2 are devoid of periosteum. There is no periosteum in the sesamoid bones. Ossify after birth usually by multiple shelter. It is the bones which ossifies after birth, and it lacks Haversian system. Okay. One of the point to be noted that it important patella is the largest sesamoid bone in the body and is cartilage coverings. The articular surface is the thickest articular cartilage in the body. And next one is the sesamoid bone are not classified as the true bones as they are not covered by the periosteum. That's why sesamoid bones are not classified bones as the true bones. Okay. And last one is the accessory bones. In the accessory bones topic, these are bones that are not generally present in the body. If present, they do not cause any harm. Okay, accessory bones are the bones that are generally not present in the body. If present, then do not cause any harm. Sometimes clinicians confuse with the fracture of a bone. Sometimes the clinician confused that is a fracture. The accessory bone may be formed due to appearance of extra ossification center in the skull suture, such as sutural and umbian bones. And number 2 is non-fusion of an epiphysis. Epiphysis, I have told, no, the two ends of the bones, or sometimes ends of the bones, specifically ends of the bones are known as the epiphysis. So when there is non-fusion of the epiphysis, there may be accessory bones occur, such as ostrigonium. Ostrigonium is the one of the non-fusion of the epiphysis. Ostrigonium. 1 minute. Here is the ostrigonium, os vesalineum, and patella cubitti. These are the three. What is ostrigonium? The posterior tubercle of the talus is that fails to fuse with the rest of the bone. The posterior tubercle, when fails to fuse with the rest of the bone, that is the ostrigonium. The posterior tubercle. It is one of the epiphysis. Now the styloid process of the fifth metatarsal that fails to fuse with the rest of the bone. The styloid process, that is the epiphysis, fails to fuse with the rest of the bone is os vesalium. Okay. Number 3 is the patella cubitti. Occasionally, the center of ossification for the olecranon process in the ulna, olecranon process, we'll later study olecranon process in the ulna, fails to fuse to the proximal end of the sac. Fails to fuse with the proximal end of the sac. The olecranon process is also one of the epiphysis. Fails to fuse with the proximal end of the sac is the patella cubitti. Okay. And the heteropatopic bones sometimes forms in the soft tissue where they are not normally found. That is the rider's bone in the tendon of the adductor longus muscle thigh. Okay. So this one is number A. Topic number A. According to the shape. Okay. Now we'll study the structural classification. Macroscopically, the architecture of bone may be compact or cancellous. Compact is dense or cancellous. Most bones of the body have a basic structure of the outer region. Outer region of the bone is region of compact bone, or inner region of the bone is the spongy or cancellous bone. Outer region is the compact bone, inner region is the spongy or cancellous bone. Okay, in long bones, the shaft consists of compact bone forming a cylinder that surrounds a central cavity called as the medullary cavity. Long bones, normally what happens, the shaft, the middle portion consists of compact bone. The compact portion is the outer region which surrounds by a central cavity. The shaft is the compactness of the shaft is through the uh, outer part, and the which is and the cavity in the central portion is known as the medullary cavity, and the ends of the long bones consist of the cancellous bone surrounded by a thin layer of the compact bone. The ends of the bone, in the shaft of the bone there is compact bone is the medullary cavity. Ends of the bone consist of the cancellous bone surrounded by a thin layer of compact bone. Okay, in flat bones of the skull, the cancellous bone is sandwiched between the plates of the compact bone. The cancellous portion is sandwiched between the plates of the spongy part is called the diploid, and outer and inner plate of the compact bone are called as the tables. Okay, now we will study the compact bone or dense bone. The compact bone is dense, ivory-like structure, no visible space or on naked eye. The compact bone consists of three lamina of collagenous sheet, Haversian osteon. Consists of the concentric lamina. The lamella of the compact bone consists of three types of lamina. One is concentric lamina, interstitial lamina, or circumferential lamina. Concentric lamina which surround the Haversian canal. Interstitial lamina lie between the osteon, and the circumferential lamina which are flat plates extended around the bone. Next one is the Haversian system or osteon. What is Haversian system? Each Haversian system consists of the Haversian canal or the central canal surrounded by a concentric lamina of the bone. The Haversian canal lies parallel to the long axis of the bone and contains blood vessels, nerves, and loose connective tissue. The concentric lamina are 4 to 20 in number, forms ring around the Haversian canal. The osteocytes are located between the laminar links of the lacuna. Okay, in this portion, one most important part is the Boltzmann canal. What is Boltzmann canal? The Haversian canals are linked by the endosteum and communicate with each other with the medullary cavity and with the surface of the bones by numerous Boltzmann canal. The Boltzmann canal run perpendicular to the long axis of the bone. Okay, where is the Boltzmann canal? Will these are the Haversian canal. Okay, this is this picture. You have to draw this picture. Haversian canal, lacuna canaliculi. This portion also, and this whole portion is known as the Haversian system. Here are the Boltzmann canal. See, these are the Boltzmann canal. These are the, and these are the Haversian canals. Okay, this in this you have to draw this picture. And number two is the one is the compact part, one is the cancellous part. Cancellous part is also known as the spongy bone. The cancellous bone is a meshwork of bone. It consists of interconnecting rod and plates of the bone called at the trabeculae. In the compact bone, that is the main system is the Haversian system, and in the cancellous part of the bone, which consists of the trabeculae, enclosing large spaces filled in the red bone marrow. The trabeculae consist of superimposed lamella and do not form Haversian system because they get nutrition from the blood vessels. Okay. Now the difference between the compact and spongy bone. In the density, the dense like an ivory structure, it is porous in structure. Haversian system present, absent. Arrangement of bony lamina regular, bony lamina are present, it is irregular in the spongy bone. Location in bone is the outer region of the bone is the compact bone, and inner region is spongy bone. Bone marrow absent in the compact bone, present in the spongy bone. And amount in the body weight is 75% and 25%. Okay. And next is these are the microscopical classification and macroscopical classification too. And now the microscopical classification is the open and laminar system. Open and laminar system. Okay. Next and last is the developmental classification. Developmental classification of bones. In the development classification of bones or ossification. Developmental means bone development means is also called as the ossifications. According to the process of bone development, ossification, the bones are of the following three types. One is membranous bones, not just membranous ossification, developed by the membranous ossification. Number two is the cartilaginous bone that developed by the endochondral ossification. And number three is the membranocartilaginous bone developed by both membranous and endochondral ossification. I will read the details of the ossification later on. Okay, one chapter is there in your topic is the classification. Okay, next we will go to the cross structure of a typical long bone. Important portion in the exam when there are exam the questions comes if you write about the structure of a typical long bones. The typical long bones I already told consist of three parts. A shaft is the mid portion and two ends. So we'll go to the see the shaft portion. 1 minute. This portion is the shaft. This portion is the shaft. The mid portion known as the shaft and two ends. These two ends. Okay. The shaft is an elongated part between the two expanded ends. It is made up of outer thick cell and a compact bone enclosing by a cavity called the medullary cavity. And the two ends are knobby expanded are largely made up of cancellous bone covered by a thin cell of a compact bone. The ends of the long bone are covered articular or hyaline cartilage. Now, here are the examples of the development of the long bones. Membranous bones of the cranial or vault, cartilaginous of the bones, base of the skulls, vertebrae, sternum limbs, and membranocartilaginous mandible, clavicle, occipital, temporal, and sphenoid bones. Next, periosteum and endosteum, it is not so important. We'll go to the you can know about the periosteum, what is periosteum and endosteum. One thing, the periosteum is a thick fibrous membrane covering the entire surface of the bone except at the area covered by a articular cartilage. Periosteum, in one word, you can say periosteum is the covering of the bone. Okay, the outer surface, here see, the outer surface of all the bones are covered by a thick fibrous membrane called as the periosteum, where the inner surface they are lined by the thin membrane called the endosteum. The outer surface is the thick, inner surface is the thin, outer surface is the fibrous membrane, inner surface also thin fibrous membrane, but the outer portion is known as the periosteum, inner portion is known as the endosteum. Okay. The function of the periosteum, mainly it protects and shape of the bone and protects and maintains the shape of the bone, nourishes the outer part of the overlying cortex, provides attachment to the ligament, tendon, muscles and intermuscular septum, and provides regenerative. In the endosteum is the cellular membrane that lines the medullary cavity of the shaft. The osteoblast and osteoprogenitor cells within the endosteum plays an important role. Okay, and last is in short is the nutrient foramen. Is usually present near the middle of the shaft for entry of the artery. There is the one foramen. Foramen is hole in the bone. That is for the nutrition of the bone. The nutrient artery enters from the nutrient foramen. Okay, it is present in the middle of the shaft. And last one is the bone marrow. Okay, the bone marrow is the soft, loose vascular tissue consisting of the delicate network of the reticular fiber and various types of cells. It is the main site of hemopoiesis. In physiology, you will read the hemopoiesis, most important topic in the physiology. If it is present in the medullary cavity of the long bones, the bone marrow present in the medullary cavity of the long bones and the cavities of the spongy bones only. Okay, types of bone marrow are the red bone marrow, yellow bone marrow. Red bone marrow is vascular, appears red in color. Normal bone marrow is red in color. To the presence of the red blood cell, it consists the network all stages development immature, and the next one is the where we will found the bone marrow. You have to read end of long bones, sternum, ribs, skull bone, iliac crest, and vertebrae. And yellow bone marrow is mainly consists of the adipose tissue. However, few it is as a severe when the conditions such as severe bleeding or hypoxia, the yellow bone marrow converts back into the red bone marrow. Okay. Now another topic which comes most important in the exam, it's the parts of growing long bone. Okay, the parts of a growing long bone, the epiphysis, epiphyseal plate, metaphysis and diaphysis. Okay, the epiphysis I have already previously told. The epiphysis are the ends of the long bones which ossify from the secondary center. The epiphysis are the ends of the long bone which ossify from the secondary center. Which one is the epiphysis? See, this one is the epiphysis. Okay, types of epiphysis are 1 minute. Pressure epiphysis. It is also in the last year exam. So the question come about the pressure epiphysis. Okay, short note about the pressure epiphysis or 2 marks question of the pressure epiphysis. What is pressure epiphysis? It is covered by an articular cartilage and takes part in the transmission of the body weight. Examples such as head of the femur, head of the humerus, and lower head of the radius. Where there is pressure of the body occurs. Head of the femur, the whole pressure of the lower portion of the body occurs. In the head of the humerus, the upper portion of the body, that is the pressure epiphysis, where it is covered by an articular cartilage and takes part in the transmission of the body weight. Here the body weight transmitted from the here to here, the head of the humerus from here to here. Okay, these are the pressure epiphysis. There, see, this is the example of the pressure epiphysis. This epiphysis is more important. Next one is the traction epiphysis. It is produced by the pull of the muscles. Example, greater and lesser trochanter of the femur. We'll study later on details about the femur. You will see the greater and lesser trochanter and lesser tubercle of the humerus. Okay, greater and lesser tubercle of the humerus. Well, you see those. It is always non-articular and provides attachment to the muscles, and it always ossify later than the pressure epiphysis. It ossify or formation or later on the traction epiphysis. Okay, now another important is the atavistic epiphysis. Atavistic is the independent bone in the lower mammals. If man gets fused to the nearest bone to receive the nutrition from the host bone, it gives like a parasite. The coracoid process of the scapula. In the previous topic, we read about the coracoid process of the scapula. One minute. Coracoid process of the scapula. Posterior tubercle of the talus, which is also known as ostrigonium. Previously we read about the ostrigonium. And last one is the aberrant epiphysis. Aberrant epiphysis, it is the epiphysis it is an epiphysis which appears at unusual end of a short long bone. The epiphysis at the head of the first metacarpal. Normally the epiphysis appears at the base. Number 2, after the epiphysis, number 2 is the epiphyseal plate. Epiphyseal plate after epiphysis. These are the epiphyseal plate. Okay, this one is the epiphysis. This one is the epiphyseal plate, the growing plate. Yeah, one. It is also known as the growing plate. In childhood, we can see this portion. The bones elongate from this portion, from childhood to adult. Okay, elongate the both sides in this portion. Okay. What is the epiphyseal plate or growth plate? It is a plate of hyaline cartilage which intervenes between the epiphysis and the diaphysis. Diaphysis is the middle portion or sap portion of a growing long bone. The proliferation of cells in the epiphyseal cartilage is responsible for growth in length of a long bone. After the fusion of After the fusion of the epiphysis with diaphysis, the bone can no longer grow in length. The epiphyseal plate or cartilage is nourished by both epiphyseal and metaphyseal arteries. Okay? The epiphyseal plate is nourished by both epiphyseal and metaphyseal artery. And number 3 is the metaphysis. Metaphysis is it's in between the portion between the diaphysis and epiphyseal growth plate. Okay. The end of the diaphysis towards the epiphyseal cartilage is called as the metaphysis. This is the most actively growing area. This is the portion. This portion is known as the metaphysis. This portion is known as the metaphysis. This portion epiphysis. Epiphysis growth plate. This portion diaphysis. This portion is the metaphysis. The end of the diaphysis toward the epiphyseal cartilage is called as the metaphysis. This is the most actively growing area of a long bone. Before fusion of epiphysis, the metaphysis is profusely supplied by blood from the nuchal, periosteal and juxtaepiphyseal arteries. These are the end arteries and form hairpin-like veins. Therefore, metaphysis is the common site of osteomyelitis. We will later study in the third year about the osteomyelitis. What is the condition that occurs in the children for bacteria and emboli are easily trapped because of the hairpin shape of the bone. A bacteria or emboli, any emboli easily trapped in this portion of the bone, the epiphyseal portion of the bone. So, due to bacterial trappedness, the osteomyelitis occurs in this portion of the bone very commonly. After the epiphyseal fusion of the communication are established between the epiphyseal and metaphyseal arteries. As a result, metaphysis contain no more end arteries. For this reason, osteomyelitis in this region are rare in the adult. In children, where there is always growing the end arteries, such as hairpin arteries or metaphyseal arteries and epiphyseal arteries are common. But in the adult, these are rare because they are fused. Fusion occurs. Last one is the diaphysis. It is the elongated part of the long bone between the metaphysis. This is the diaphysis portion. This portion, see, middle portion, this whole portion is the diaphysis portion. The blood supply of the bone, of the long bone, contains of nutrient artery. Okay, nutrient artery where there is foramen in the diaphysis region. Previously we know about there is foramen, see. And the 1 minute. Next one is the periosteal artery. Number 3, metaphyseal, a juxtaepiphyseal artery and epiphyseal artery. And in case of short bones, the blood supply to the short bone are the nutrient artery and periosteal vessels. Okay, so these are the portion which we will study, and in another chapter we will study about the ossification of the bones later on. Okay, ossification on bones we will study later on. So today's topic ends here. So if any query regarding this, you can comment on the comment section. Okay, thank you.